I really relate. I don't relate. We just did a show on family law. Thank God I don't have a divorce problem. But I do have pain problems. You know, when we get to that age, pains that we never even thought about arise. So we've got American pain experts, and your partner was on last time with us. And we have Dr. K on with us today. And Dr. K, boy, I tell you what, everyone who comes to your office has got a pain.
That's right.
So it's not like, you've got the flu or something. They're not going to come to you. So I think this is probably one of the most interesting shows. And I would say, from our letters we get, low back pain. Does everybody have low back pain?
Yeah, that's right. Actually, chronic pain affects more people in this country than diabetes, high blood pressure, cancer combined. And it costs a lot more to healthcare and our economy in general, in direct and indirect costs.
People miss work.
Because people miss work all the time. They file for workers' comp claims, all kinds of things. So it is a huge burden to our healthcare system, and it is a very, very common problem and a painful problem.
You just said chronic pain.
That's right.
Is there a difference between chronic pain and just pain?
Yes. So pain inherently is actually a protective response. It is meant to protect you from injuries. So, for example, if you put your hand on a burning kettle, and if you did not have pain, you would leave your hand there. You wouldn't know about it.
Right, that's right.
So the fact that you feel pain, you withdraw from that from the stimulus that is causing pain, it means that there is something injurious, something harmful happening to you. So there are inherently two types of pains. One is called acute pain, or some pain which stays for much shorter duration, which is there to be as a protective response to a harmful stimulus. And the other one is chronic pain. So the chronic pain is any pain that stays for more than 3 months by definition. Now, what happens if the pain stays too long, or if the injury is happening too chronically or for a longer period? That pain becomes an intrinsic process. It becomes a self-perpetuating cycle. So, you have more pain because you have more pain, and then it causes more stress, more muscle spasms, more everything, and then it causes more pain. And then it leads to, different kinds of problems, like, you lose work, you become stressed out, your social life is impaired, and all of that also causes more pain. So it becomes a vicious cycle.
Well, we had someone today because we promote Ask the Experts on Twitter, and we get questions. People say, oh, I'm going to be in my car, I'm going to be at work during the show, can you ask the doctor this? It seems low back pain is probably the most talked about pain there is. Do you see that in your practice?
Absolutely right. I think majority of our patients suffer from low back pain. I think the second most common complaint is their neck pain. Now, the reason why low back pain is very common is because of multiple things. One is low back is prone to having issues because of the way weight distribution happens. We have high prevalence of overweight people, and that also affects the lower back. Also, there's sedentary lifestyle. People are not exercising. They're not, doing the workouts or going on a treadmill. So all of that combined has the effect of, back having problems. So what leads to chronic back pain or back pain in general? You have muscles, you have ligaments, you have bones and joints. The spine, which is the backbone, is actually a stack of bones. It's bones stacked on top of each other. It's like, a stack of pancakes. And they have to stay in balance, in alignment with the help of multiple things that are kind of tied
so that's
all
why
around
it's always low back pain, because
That's
you got
exactly right.
all these bones that are stacked on top of each other.
And to top it off, it's not a straight stack. It is a stack with a little curve, normally. And that curve is most pronounced in the lower part of your back. And as you can imagine, when the center of gravity shifts forward or backwards, that curve gets a little bit exaggerated. The joints get a little bit more stress, and hence people have back pain.
Wow. We also had someone ask about muscle spasms in their calves, that they wake up tonight and they said it's the most excruciating pain there is. What do people do for spasms like that?
So muscle spasms or cramps can have multiple reasons. A very common problem is actually muscle spasms from the nerve compression that also happens from the back. When you have back arthritis or back problems in general, the nerves that come from your back and go in your leg, they may also get affected. They get bruised up, they get irritated. And when people are sleeping, obviously they're not watching their back, and
That's
they
right.
go into bad arches or they go in bad posture. Sometimes those nerves get tickled at night, and hence they wake up with excruciating pain in their legs because those nerves are getting tickled. And then they have to sort of arch in a specific way in order to, for this pain to get better, or take a pill or something. Similarly, there are other reasons why you have cramps in the calves. Electrolyte imbalance is a very common problem. People take blood pressure medications. Sometimes they, increase or decrease their sodium or potassium levels. So I would suggest to these people that keep themselves well hydrated, take electrolytes.
So fluids are important.
Absolutely. Electrolyte supplements, Gatorade, things like that, and, get themselves checked out by the doctor.
Well, now that we've let people know that you specialize in pain, tell everybody about your practice.
So, we have a multidisciplinary pain management practice, and I'm going to spend a second explaining what is a multidisciplinary pain management practice. I, myself and my partner, Dr. Tom Machek, we are both board-certified pain physicians, so that's a very important thing because not everybody who's practicing pain management is formally trained.
So you can actually say you're a specialist.
I am a true specialist, and we have taken the tests, and so my primary specialty is neurology. So I'm a neurologist and a pain physician. I've got a double board certification.
So does that mean you deal in headaches?
I do deal in headaches a lot. Dr. Machek is an anesthesiologist in pain management. What we have in our practice, and which is different, is that we use different kinds of modalities to treat pain that include physical therapy, massage therapy. We do all kinds of injections, which are targeted way of delivering medication, where the problem is to minimize the whole body getting that medication, which is never good. So we are trained to do all of these things. We also use, in some cases, things like acupuncture. We do use medications too, but it's important to try to get help from whatever sources we can than to just rely on medications that a lot of pain doctors do, which is not the right approach.
What is this? Is it radio frequency that I hear? Is that right? It's called...
That's right, yeah. So
they're using for pain.
It is used for chronic back and low neck pain. It is a technique where we use a special needle. It's not a surgery. It's still an injection, considered an injection. We use a special needle. The tip of that needle can get hot when we want it to get hot. And we put that needle into a target spot where the tiny nerves are, which are causing pain. Now, the function of those nerves is nothing but to cause pain. So, it's just a matter of trying to quieten them down. So this procedure, what it does is we put the needle tip close to those nerves and we increase the temperature of the needle tip. And while that is happening, nobody feels anything because you're nice and numb, and we just kind of coagulate or burn those nerves. And for lack of a better word, there's no better word than burning, but it's actually not char burning. It's hot enough to cause complete disruption of those nerves, and that is called radiofrequency ablation.
So now where's your office at?
We are located on Oakland Park, so 1164 East Oakland Park Boulevard in Oakland Park, right off of Dixie and Oakland Park. And you can't miss it. It's a big building. It's called American Pain Experts. And as I said, we have everything under one roof. We do injections, physical therapy, massages, and there are doctor consultations on campus.
Is there any... Now, you deal with, I guess, like we said, headaches?
Yes.
So migraines are a lot different than a headache. So I'll bet you deal with a lot of migraines, because I've seen people who have migraines, and it's beyond excruciating. And a lot of times they get sick to their stomach. They have to be in a dark room. How do you treat migraine headaches?
So migraines are a very specific kind of headaches. I wouldn't call migraines not headaches. They are headaches, but they're a very specific kind of headaches. They happen because of a very specific set of problems that happen in the blood vessels of the brain. It's important to understand that migraines inherently are not dangerous, okay?
Tell that to someone who's suffering from a lot of pain.
All right. Well, you have personal experience. So, I've had people who've had migraines for like 40, 50 years, all their lives, and they were able to function through them. As long as you control their headaches, they're not dangerous. They're not going to put you too much at risk of having major problems, So even though they're excruciatingly painful, they're not dangerous. Number two, it is a problem that affects younger people who are otherwise healthy, functional. People who have bad migraine episodes, they tend to lose work. They, get into all kinds of problems. So it's important to treat them effectively because A, they're benign or they're not very harmful, and B, they affect young people. How do you treat them? Well, there are different tiers of treatment. If they're mild and spaced out, like if you have one episode every 2 months or every month, then you just take a medicine when you have the first signs of headaches hitting you. And that usually takes care of it. And there are different kinds of
How do you diagnose that? How do you diagnose migraines versus headaches?
So, once again, different kinds of headaches. Migraine is a very specific kind.
Is that the worst? Is that the most painful?
It is perhaps one of the most common one.
Okay.
And perhaps one of the more painful one, too. But there are some other kind of headaches that are even more painful than migraines.
Wow.
It's extremely painful headaches, but they are super rare, fortunately. The migraines are treated using different kinds of treatments. One of them is basically what we call as abortive treatment. When you have the headache, you take the medicine. The diagnosis is what we call as clinical. What is a clinical diagnosis? It's just diagnosed on the basis of history and examination. So there are certain features of headaches that a person describes to me, which makes me think if they have migraines or some other kind of headaches. Like what you said, if they get sick to their stomach, if they get nauseous, sometimes they throw up, they need to hide from the light and, in a dark room. And then they kind of just sleep for a few hours and they wake up with no headaches. That is a very classic history of migraine. Sometimes they have some warning signs, like they have abnormal smell in their nose. Sometimes they see flashing lights in their eyes.
Before the migraine comes on.
That's exactly right, right before. This is called aura. And that is also very classic for migraine.
So there is medication for migraines.
Absolutely, yeah. So what I was talking about earlier is that if you have occasional and sporadic migraines, like when you have, say, one episode every month or 2 months, then it doesn't make sense for you to take medicine every day to prevent it from happening because it's so far out. So you just take the medicine when the migraine comes. But, many times the frequency of the migraine is so much that you have to, it's justifiable to give the patients preventative medication. So what is a preventative medication? It's supposed to be taken like a blood pressure medication every day, regardless if you have migraines or not. And the function of that medicine is actually to prevent the migraines from happening.
I would take that every day, without a doubt.
That's exactly the way you should take it.
Okay, so at least that's good to know, because you meet people and I tell them, I've got a radio show. We have a pain doctor, someone who specializes in pain. And you find out they've had the same pain for 25, 30 years. They've gone to different doctors. And I think this is great. This is what all you do. It's not like going to maybe you wouldn't go to an orthopedic surgeon, but maybe you go just to a general practitioner. Pain is all you deal with. That's it. So nothing's really new to you. When someone comes in, you're probably going to be able to diagnose them clinically. But when they come to your clinic, this is all you do.
Yeah, that's right. So, that's why I said that it's probably good to see somebody who's specialized in managing pain and who have all the different modalities and disciplines to try to treat pain. I'm not saying that people who treat pain or try to treat pain with medications without having much knowledge of how else to treat the pain are doing necessarily a bad job. It's just that you're not utilizing all the other things that are available that the experts like us have. And also, you are unnecessarily putting a patient at risk of developing tolerance and addiction to some of the stronger pain medications. So, as we know, we are in the middle of what we call as opiate epidemic.
Yes.
And unfortunately, a lot of patients got placed on those strong pain medications for trivial reasons to start with, and then they became dependent on them, and hence they developed another major problem. So this is what we try to avoid doing, and hence we use all the other modalities that I was talking about: injections, therapies, massages, acupuncture, all of these things. So yeah, it's always good to see somebody who's formally trained in treating pain. And also, even if you have a spine problem, you have spinal stenosis, you have a disc herniation, you name it, it's always good to see somebody who has a sort of broader horizon, who knows a bit of surgery, a bit of injections, a bit of other things, rather than going to a surgeon directly. Because, just like if you have chest pain, you go to a cardiologist first, you don't go to a cardiac surgeon, right? So you
Right.
have to have somebody evaluate you properly, take proper history, do all the necessary MRIs or other imaging modalities, try an injection, something less invasive, before we decide that, listen, nothing is working, you probably need to see a surgeon.
We're going to go to break, and when we come back, I've got a question I bet you no one has ever asked of you. I got it this afternoon, actually, right before the show. It deals with gout.
Okay.
So we come back. Now, give everybody your phone number.
Yes, our office number is 954-678-1074.
And you got a great website. What is your website address?
So we have two websites, actually. One is American Pain Experts, one word, AmericanPainExperts.com, and the other one is the Apex, APEX, paincare.com. So we have two websites working. You can actually make appointments online, or you can call us and make appointments.
And we'll give those again towards the end of the show. We're going to go to break. We'll be back with Dr. K, American Pain Experts.
Are you tired of suffering ongoing pain? At the American Pain Experts, they offer a comprehensive approach to pain management. The Apex physicians are experts in providing the newest procedures resulting from the advancements of modern technology. They recognize that incorporating these interventions is an integral part in achieving pain management. Their physicians are highly trained and skilled in the complex procedures that must be incorporated for a successful outcome in pain relief. A unique combination of medications will be personalized for each patient, focusing mainly on non-opioid medical therapy. Careful attention will be given to minimize unwanted side effects and habit-forming behaviors of opioid therapy. Depression, anxiety, and stress are all contributors to worsening pain symptoms. Medications and counseling can significantly improve pain management. For a free consultation by the American Pain Experts, call them today at 954-678-1074. That's 954-678-1074.
We're back. See, when you have these interesting shows, they go by so fast. We're sitting here with Dr. K. If you have any type of pain, which Dr. K just told me about, because you deal in all types of pain, and I know that for a fact now because we got on Twitter today, someone asked me, do you deal with gout? And you do. And they said it's so painful. Well, if someone like me, I've never had it before, I have no idea, but they said it's extremely painful.
Yeah, that's right. So it is one of more painful diseases that we see. So gout is actually a disease which causes excruciating joint pain, and that happens because of abnormal deposition of crystals in the joints. And these crystals are made of uric acid. So I don't know, a lot of people have actually been to their primary care doctors. The primary care doctors check uric acid routinely sometimes to see if their uric acids are high. Now,
Is that from food you eat?
it is a combination of different things. So yes, if you eat too much of meat, then yes, your uric acid perhaps would be a little high, and also the way your body is handling with uric acid. So everybody produces uric acid normally in their bodies. Some people are just more prone to not handling that uric acid production well, and hence, their levels go higher in their body, and they abnormally crystallize in the joint spaces. And then joint spaces, as you know, are supposed to move, glide normally. There shouldn't be any sedimentation or any crystals or sand-like structures in somebody's knuckles and toes, right? So when that happens, it becomes extremely painful because it causes a lot of inflammation. The joints get painful, red, tender, hot, and swollen.
Is it just in the feet, Dr. K?
Typically, it happens at the base of the big toe.
Okay.
But it can happen in any joint of the body. It typically affects the small joints of the hands and feet, but it can happen in bigger joints too.
Well, number one question that we had was about arthritis. Is there a cure for arthritis? Or do you just have to take the edge off when it comes to arthritis? Because we had 6 people ask about arthritis. And that could be anywhere, right? I mean, that could be in, I guess, your hands or your legs or your back. Just about anywhere, right?
That's right. Yeah. So arthritis, by definition, is the inflammation or irritation of the joints. That's what it means. Now, why does that happen? You know, as they say, there is no cure for aging. You know, when you go old, you can't go back young again. Similarly, when you've used your joints all your life, and depending on what kind of activity levels you had, you know, some people have been runners or basketball players or construction workers, they tend to use their joints more than people who are relatively, sedentary, not very active. So basically, you use your joints all your life and they get wear and tear. And it's like using a piece of furniture for 40 years and you will see some wear and tear. So that wear and tear is what's arthritis. Now, there are some joints where the science have now come to the point where you can replace the joints completely, like knee and hip, shoulders. So when you have arthritis, which is advanced to the point that nothing can be done about it, the doctors can go in and give you a new titanium knee or titanium hip. That's called hip replacement or knee replacement. Unfortunately, that cannot happen with the spine.
Right. Yes.
Right. So nobody can give you a new back or a new neck. Right.
You're not doing spine transplants yet.
Absolutely. That's it. Because it's just too complicated, and there's a spinal cord which is sitting inside of that spine, and there are nerves that are coming out. You know, there are major blood vessels in close proximity. So nobody can get you a new spine. If the problem becomes too advanced and there is compression of the nerves and somebody's losing function, then yes, 1 or 2 segments of the spine can be done surgery on by surgeons, but that does not guarantee the problem wouldn't happen to the next level or the level next to it, because there are a total of 31 vertebrae from your base of the head all the way to your tailbone. So it's not an isolated problem, it's a diffuse problem. And hence, it's always better to come up with a strategy which deals with it in a long-term basis rather than just thinking about an escape. Or what can you do to just fix it? Well, nobody can fix it. You have to live with it. Like you have diabetes, you need to live with it. And we are here to teach and help you live with it.
So you help them to manage it, what you do.
That's exactly right. So that's why our field is called pain management and not pain cure.
Right. That makes sense.
So we help them manage pain. We tell them, listen, nobody's here to fix your pain. It's perhaps not going to go away completely. We will help you live with it, so we can get you back to your work. We can get you to enjoy what you want to do, play golf, play with your grandkids, whatever it wants to take. And then we will have different modalities that will help you little by little, step by step towards that goal. And obviously, those all include injections, some medications, physical therapy, massages, all of these things. So our patients actually see us very regularly, and we kind of evaluate them on an ongoing basis to see how their pain levels are and base our treatment plan off of that. And hence we develop a good, friendly relationship with them, because, I don't want them to feel that, this is kind of a big deal to get an injection or see a doctor. This is part of your life now, because you've had pain for 15 years. There's no reason why you won't have pain in 2 years, right? So make it look like a more part of your life, make it more mainstream, and yes, we are here to help them live with it.
I've always heard that if you have a bad back, not to have surgery. That should be the very last thing, because people who've had back surgery are never the same again. Is there any truth to that at all?
Well, it really depends on why you're having the back surgery. What was the reason? And, in general, you're right. In general, it's important to understand that whatever leads to the back surgery has to be a more diffuse problem. And the surgeon is going to fix just one component of that problem to either prevent an immediate danger to your legs or loss of function or something on those lines. But it does not guarantee that one segment, once that's been operated on, the same thing will not happen to the next segment. Since it's a continual process, and then it is a diffuse process. So I'm the first one to send patients to surgeons if I feel that their nerve functions is getting compromised because of the arthritis of their back, and the pressure needs to be taken off the nerves. But I don't necessarily send patients for surgeons if it's only a pain problem. We can fix pain. We can make the pain better. There are different things that we can do to make the pain better. But the surgery itself, unfortunately, a lot of unnecessary surgeries are done which are not warranted.
Well, you know what? I could talk to you for an hour easily. This is going to be a great show. We started off a couple months ago with your partner, and we're going to be gathering questions again from listeners of the show. You'll be back with us again next month. Give everybody your phone number again.
All right, so our number is 954-678-1074. That's our practice number. You can call it that number. My name is Dr. K or Dr. Khurshid. I am a neurologist and a pain physician. We have double board certification, both of our doctors. The other doctor is Dr. Tom Machek, who's been in this show before.
Right.
So,
and give everybody, you got 2 websites, give everybody both your websites.
That's right. So Apex Pain Care, APEX Pain Care, and AmericanPainExperts.com. So both sites are up and running. They both have the numbers and online portal to make appointments.
Okay. Hey, listen, we got to get out of here. Thank you so much, Dr. K, for coming in today. We'll be back next week with more Ask the Experts. Everybody have a wonderful and blessed week. We'll see you again next Thursday at 5 p.m.
Thank you.